Hello everyone. For this video, let's talk about joint effusion. Or for most of us, refer to this as water on the knee. If you are experiencing pain and swollen knee, you may be having gout, arthritis, or water on the knee called joint effusion. Please stay tuned until the end of the video to understand the symptoms and treatment of joint effusion, or known as water on the knee. At this moment, let's understand, what is joint effusion? Here is a brief explanation. Let's watch it. Joint effusion, often referred to as water on the knee or swelling in a joint, occurs when excess fluid accumulates in or around a joint. The condition can affect any joint, but it is most commonly seen in the knee, ankle, elbow, shoulder, and hip joints. The fluid buildup can result from injury, infection, or underlying health conditions such as arthritis. Of course, we need to know what are the causes and roots of this pain, right? Injury or trauma, these are the primary causes of knee pain. Fractures, ligament tears, or damage to the cartilage can lead to fluid accumulation. Infection is the second most common cause of knee swelling and pain. Bacterial infections within a joint, septic arthritis, can cause effusion. The third cause is arthritis. Most of the time, people with arthritis are high risk in developing water on the knee. Conditions like osteoarthritis, rheumatoid arthritis, and gout can cause inflammation, leading to excess fluid. Other conditions also, do not forget your other health conditions that can cause joint effusion or water on the knee. Conditions like bursitis, tendinitis, or bleeding disorders may also result in joint effusion. Symptoms of joint effusion now. What are the common symptoms of water on the knee or water on the joints? Continue watching. First on the list is swelling, obvious or visible or palpable swelling around the affected joint due to fluid buildup. Second is pain in the joint, which may worsen with movement or pressure. Third on the list is stiffness, reduced range of motion in the affected joint. Fourth is feeling warmth in the affected joint, the skin over the joint may feel warm to the touch. Fifth is the redness, the skin may become red or discolored if inflammation is present. A very common symptom is tenderness, the joint may be sensitive to touch. This is one of the most early symptoms a person can feel. The last and final symptoms is difficulty moving, mobility of the joint may be restricted, making it difficult to bend or straighten the joint. After knowing the symptoms, of course, we want to know how to treat it. Next are the recommended treatments for joint effusion. 1. Rest and immobilization. Reducing activity can help alleviate pressure and pain. Immobilizing the joint with braces or splints may help manage symptoms and reduce fluid buildup. 2. Cold or heat therapy. Cold therapy, ice packs, reduces inflammation and swelling, especially in the early stages. Heat therapy, warm compresses, can be used to improve blood flow and ease stiffness after the acute phase. 3. Medication. Non-steroidal anti-inflammatory drugs, NSAIDs, ibuprofen or aspirin can reduce pain and inflammation. Corticosteroids, injections into the joint may be used to control inflammation. Antibiotics, if the effusion is caused by infection, septic arthritis, antibiotics may be needed. Diuretics, in cases where fluid retention is the underlying cause, diuretics may be prescribed. 4. Aspiration, arthrocentesis. A doctor may use a needle to remove excess fluid from the joint aspiration. This can relieve symptoms and allow the fluid to be tested for infection, crystals, gout, or other conditions. 5. Physical therapy. After the swelling subsides, physical therapy may help strengthen the joint, improve mobility, and reduce the risk of recurrence. 6. Surgical intervention. In cases of severe joint damage or chronic effusion, surgery, for example, arthroscopy, may be required to repair or remove damaged tissue or cartilage. 7. treating underlying conditions. Managing conditions like arthritis, gout, or autoimmune diseases can help prevent future episodes of joint effusion. When to see a doctor. If the joint is very painful, swollen, warm, or red, or if you have a fever, it's important to seek medical attention to rule out infection or other serious causes. The most important treatment is eating healthy. Remember, any disease can be caused by your eating habits. For me to continue doing educational videos like this, please support my channel by clicking the like and subscribing below. Also, learn more about your health by watching more videos in my channel. Thank you for watching.